Okay, Mbak Titin.
Yes.
One more things. If my mobile phone is run out of quota, so I will automatically log out and I will buy some quota and then I will jump in again. So please, Prof Gandes or Tama will like give like some answering the question first or something like that. Okay.
Okay.
Just in case. Just in case.
Thank you, Dr. Doni. We're on the YouTube already, and 1 more minute, we're going to start the webinar. Nadia, you have the full screen for everything, so I think you're on control, even though you're co-host. Thank you.
One more thing about the question. Nadia will send me through WhatsApp or what?
WhatsApp.
WhatsApp. Okay, so I have to open my WhatsApp. Okay.
Yep. Okay, I think we will start now. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh. It's been a pleasure to host you in a webinar. This is the webinar conducted by Medical Education Center, IMERI, Faculty of Medicine, Universitas Indonesia, in collaborations with Gadjah Mada University, Faculty of Medicine, Universitas Indonesia, and also towards University for Health or TAF organizations. Today, we're going to have a special webinar on community-based and medical health professions education adaptations during COVID-19 pandemic. So without further ado, we would like to invite the moderator, Dr. Widyandana, to start the webinar today. Enjoy. Thank you.
Okay. Good morning, everyone. My name is Doni Widyandana. You can just call me Doni. Okay. And first of all, I would like to thank you to IMERI FKUI that help us all to facilitate this webinar. It's really a good opportunity for us to join this webinar. And I would like to introduce our speakers. First is Prof. Gandes. She is from Gadjah Mada University. She is a professor in medical education and the vice dean for the academic affairs in Gadjah Mada, and also the co-founder for the FEMER Regional Institute in Indonesia, FENSIP. Yeah. For me, I'm the chairman for the interprofessional education and community in Gadjah Mada, and also I'm director of the master in medical education in Gadjah Mada. Prof. Siraj from India, he's a professor in microbiology department, and also the deputy director for the Center for Continuing Education and Interprofessional Development, Municipal Academy of Higher Education India, and also advisory board the network TUF. And the last but not least, our speaker is Dr. Vishnu Praya Vijayalakshmi. She is fresh graduate, but she is a former SNO president in network TUF, and also now in the Department of Rheumatology, All India Institute of Medical Science, New Delhi, and also at large board member of the network too. We have like 10-minute presentation for each speakers. And please, the audience, you can send the question through the chat. And also you can ask, you can join the pool. And also we will give you the link for the questionnaire through this platform. Then you can write down that link because it's difficult to attach the link in this Zoom webinar. So in this occasion, I will also to tell you that Prof. Siraj will join us till 10:30. So please, if you have a question to Prof. Siraj, make sure you put that in your question. Then we will prioritize that question to be read earlier. So Prof. Siraj will able to answer your question. And welcome for all the audience. Now I think the audience already a lot arrived in our webinar. So please, we can start our webinar. First, Prof. Gandes from Gadjah Mada. Please, you can start your presentation. You have 10 minutes and tolerance for 15 minutes. Please, Prof. Gandes.
Right. Yes, you can see the screen?
Yes.
Yeah. Okay, very good morning, everybody. It's very nice to meet you online virtually. I hope all of you are well. Thank you for IMERI that has organized this virtual conference. I was asked to talk about how our program has been adapted to COVID-19 pandemic, program on community-based education. In our university, we call our community-based education program as Community and Family Healthcare with Interprofessional Education, CFHCIPE. So during this presentation, I'm going to share about how we adapt our second and third years program, and then how the program is implemented, the challenge as well as the solution we take, as well as the evaluation result of the program and very brief reflection. Before I start to share about the adaptation, I would like to bring all of you to the concept of our program in a normal condition. So actually, we have medical student, nursing student, and nutrition student. So during their first year, second year, fourth year, third year, fourth year, they have to follow the program. So the program are joined together with the student from medical, nursing, and nutrition. They have what we call as partner family. So they work with the partner family, and the partner family are distributed in one of the districts that we work together. If you see the map, you see that each batches of the student have their own partner family in different areas. So actually, we have a number of students. First year is around 463, second year 466, and so on. During the normal program, students are divided into small groups, 5 until 6 students each group, that consists from medical, nursing, and nutrition. They work under supervision from supervisor and field instructor. So we have around 22, 45 supervisor, 18, and 23 field instructor. The number of the partner family that work together with each part is around 225 until 282. So you see, in a normal condition, that's what we have. They have to go to the community, they have to go to the field and working with the family. However, because of the pandemic, the university asked us to convert all the program into online platform. So we have to think about that. So since 15th of March, we moving to online platform. So we work for around a week to prepare this program, only a week to prepare this program. And by considering that COVID is a new disease for everybody, and then at that time, even until now, there are so many hoax about COVID. And actually, to prevent this disease, it really needs real action from each individual. Sometimes the action is simple, but it needs real action, not only knowledge. So considering that situation, we designed the program where we ask the student, the second and third year student, to greet their partner family and then provide education for them for 7 days. We are fortunate because at the faculty and university level, there are several teams working together for COVID, and one of the team is a team that provide education. So the team is called as Health Promoting University Team, together with Tropical Medicine Centers team. They work so hard to provide online education. So we use that kind of material. We didn't develop our own material specifically for this program. They work together through WhatsApp group under supervision of supervisor and field instructors. And the timeline is, it should be starting from 23rd of March. So there is a WhatsApp group that consists of 5 until 6 students, their family partner family, 2 until 3 partner family, supervisor, and field instructor. We targeted for giving education for 462 partner family. So that's the material for the education. Basically, it's about COVID, and then cough etiquette, hand washing, social distancing, and how to increase immune. So this basic material is given in every day of this consecutive 7 days within the program. The second day, beside the basic one, we ask the material about how to seek help to our hospital. Third day, beside the material of first day, is also environment hygiene. Fourth day, tips to prevent stress beside the material from day 1. Day 5, day 6, and day 7 is repetition to enhance the knowledge and action from the community. So basically, all the educational material is in the form of poster, simple poster and video. We did coordination with the team, the student supervisor, field instructor, as well as with the family, either using WhatsApp, Zoom, phone call, all the online possibility we use it. Then after the coordination, starting from 23rd of March, the group that already coordinate have a good coordination and ready to educate, they start the program. So you see here some example of the screenshot from several group chatting in a WhatsApp group chatting. Then the progress of the implementation during the first week, not all group of the student, this is the example from batch 2018, not all group of the student have work. There's some group that still prepare, still familiar themselves with the educational material, coordination with the supervisor, instructor, as well as the partner family. Second group, the number of the student as well as the partner family that already educated increased until 4th week. So you see here from batch 2018, during 4th year, already 100% done. For the 2017 batch, until the 4th week of the program, there's still one group that still have difficulty to make coordination because the partner family doesn't want to have the education, and until now, one group still trying to continue. And as you see here, until the 4th week of the program, we already reached to educate 85.4% of the targeted household partner family. So we already educated 420 partner family. Obviously, there are so many challenges and solutions. We present a few of them. So the first challenge is that there are few family, partner family that don't have mobile phone or WhatsApp. So we cannot reach them because we will not send the student to the community. So the solution that we take is we extend to other family to try to find a family around the previous partner family. The second challenge, for example, is the partner family to refuse to contribute. That the number is only few. We recruit another families. Some partner family are also busy, although this is time for working from home. And for that case, we give more time and more supervision, and finally the program can be done. We did evaluation, and this is the evaluation tool that we have. You can search from the link, the evaluation tool for the student, for partner family, as well for supervisor and field instructor. And if you see and you search the evaluation tool, you will see that some of these questions are asked to supervisor as well as partner family as well as the student, but some question only for the student, some only from partner family, some only for supervisor and field instructor. Until the 4th week of the program, the response rate from the student, supervisor, field instructor is like that. So basically from supervisor is quite low because they also have another duty, still doing online lecturing and so on. And from the student is quite good, as well as from field instructors. And the percentage of the partner family is around 37.6, so around 120 something partner family that complete the questionnaire. And this is the result of the evaluation from the student. They think that they understand the educational material related to COVID that we provide through Health Promoting University website. So it's more than 60% say agree and strongly agree. They also feel that their educational skill improving. So it's around say 70 students feel agree and strongly agree that their educational skill improving during the program. They perceive that interprofessional education is needed. There are many students that perceive that. There are also many students that perceive they offering solution to the family. That's very important. And then they also think that educational material provided by the website help them to provide education to the student. More than 90% agree and strongly agree. And the educational material answer the question or concern from the family. Regarding the guidance from the supervisor in field instructor, still quite low because they say that only around 55% agree, strongly agree. I don't know the exact reason, but perhaps some of them may, do not need close supervision. They already in 2nd year and 3rd year, they already know their family partner. And this kind of response correspond with the response from the supervisor and field instructor that I will show you later. Then the online education, very useful for students in terms of academic, as intermediate, the result I think is around 70 something. But when we ask whether the online education program is very beneficial for students because they can take a role in pandemic situation, the answer is very, very good because more than 90% of them say agree and strongly agree. And then whether the online education enhance partner family knowledge regarding COVID-19, as well as encourage them to do hand washing, cough etiquette, social distance, and increase immune system. And I think the response is also quite good. And when we asked to the supervisor and field instructor, as I mentioned previously, the supervisor and instructors also perceive that students understand the educational material. Student skill also improving, and then interprofessional collaboration take place. The response is also intermediate. When we ask to the supervisor whether the student can offer solution that are asked by partner family, you see here in the fourth bar, it's around say 77 agree and strongly agree. And for the beneficial of the educational material, as well as whether the educational material can answer the question raised by partner family, the perception is good. That's what I mentioned previously, that whether the supervisor and instructor play important role in the running of online education. You see here the response for agree and strongly agree is around 60% something or 70%. So it's really in line with the student perception. But let's we move to the other bar about the benefit of the program to the student, the third bar and the fourth bar. The response is really in line with the student response, as well as whether the online education enhance family partner knowledge, as well as encourage partner family to do hand washing, cough etiquette, social distance, and immune system. It's also correspond with the student perception. I love to see the last result because this is from the family. Although the response rate from the family is only around 100 something family that fulfill the questionnaire, 30 something percent. When we ask the partner family whether they understand the educational materials, you see that 80% agree, strongly agree, 80% something. Where the student and lecturer, supervisor, and field instructor, language is easily understood. It's quite good, the response. Whether the student as well as the supervisor answer their question, and it's also quite good. I got a solution related to what I asked. More than 80% perceive, agree, and strongly agree. And whether the educational material help the partner family to understand the explanation, it's quite well to help them. And then whether the educational material answer their concern, it's more than 78% say agree and strongly agree. Whether timing of the education interfere with their daily activities, most of them say that it doesn't interfere, although still some feel that the time should interfere with their daily activities. The lesson learned that we take from this program, the first is that we all know that COVID-19 pandemic is difficult time for everybody. However, this program showed that we can do something. Second and third year student can work with partner family, obviously under supervision, to increase family understanding regarding COVID-19 itself, as well as to encourage them to do simple action that really need during the pandemic. And what I love and learn from this program is that the response from the student that they feel they can take a role during the pandemic, and as well as that the partner family, most of them say that this program helped them to understand, to increase their knowledge about COVID, as well as to encourage them to do cough etiquette, hand washing, social distance, and how to increase their immune, and so on and so on. So at the last side, I would like to congratulate to all the students, obviously for community and family healthcare interprofessional education team in our institution, the team led by Dr. Doni. All the team worked so hard, prepare this program only in a week, then implementing this program for 4 weeks and so, and it's worked quite well. That's what I can share. Thank you.
Okay, thank you, Prof. Gandes, for your share. And please, the host, help us to post the poll. So for the all audience, now you can join our poll to fill up the two simple questions. Just click yes or no over that. And while you respond the polls, okay. And while you respond this poll, I will give you some announcement that first, I would like to welcoming you join this webinar. And the second, for Indonesian participant, please don't hesitate to give question in Indonesian language through our chat. Then the host will translate it for you. Then for the audience, I would like to also announce you that Prof. Siraj will join this webinar around 10:30. So if you have question special to Prof. Siraj, please give a notification about that. Okay. Then we have two questions. Please, host, can you show the question to us? Oh yeah. Okay, this poll is already done. So about do you have community-based medical and health professional education activities in your program institution? We can see that 87% of all our audience have this program. And the second? Okay. Okay, this is a good result. Oh, this is the second poll. You can respond this. Okay. So after this webinar, we also share you about the link for the Google form because the Zoom have difficulties. Give a link. We have difficult to show you the link in this platform. So you can just write down the link or copy paste it. Then you can respond to the to the Google form format. Then we can collaborate after that. The second poll, do you have already the result? The host? Okay. Yeah. For the second poll, do you still continue the CBE program during this pandemic? No. We can see the nice result here. So 87 audience show that they have this program, but we can see here that only around 60% of the audience continue in the program. So it's nice. It's nice result. Then we can see that somebody have difficulties to continue the program during this pandemic. So I think this webinar will be useful for us. Okay. Okay, now it's my turn to continue my session. Now the second opportunity is for me to share my experience about how to implement our program. So continue from Prof. Gandes' presentation that how to implement this program is not easy. So I would like to share you about our program, especially for the year 1. So for the year 2, slide next. For the year 2 and 3, Prof. Gandes already show you that we have already attachment in for the families. Then we can continue the attachment with the family through the online platform. But for the year 1, it's quite difficult because they have no experience and that kind of thing. So we have different program. So for the year 1, this is adaptation phase. They have lack of experience, they lack of prior knowledge. All activities still should move into online platform because we have work from home platform. So the institution gives support for the Zoom account. We have like 15 Zoom account that we can use in our faculty. Then we have to support the government. Now we have to think that this so must go on. So we have to make some innovation for this first year student. Next slide. So I would like to share you that before the pandemic COVID, so the all activities oftenly conducted face-to-face. Slide. But in this during pandemic, we have to modify it, and actually we not totally modified the program. Before the COVID, we already asked the student to post their result through the YouTube channel, because they make the video, they make the electronic poster, and they have to post it in our Instagram account. So we try to modify this kind of style into this new format for the pandemic response, right? Yeah, so for the year 1 activities, we encourage the groups because they never have like a family attachment before. So we ask them to attach with their own social media. So we ask them to develop poster. This is the example of their poster that they developed. You can see that it's very nice poster. They have their own prior knowledge to develop poster. In each group, they have to collaborate between medical student, nursing student, and nutritionist student, because we have interprofessional education concept in these activities. So you can see that they can collaborate and develop this material. Slide. The format also developed in the electronic poster and also in video. So we can see that they also make video, and we can track their activities from their social media, because we ask them to give hashtag in their post. So they can make a poster, essay, video, then they have post in the social media, then we can track down that, and they can send us the screen capture of their posting. Yeah, slide. So we have a good response from the student, from the first year student. You can imagine they're still first year student, but they can join our program for the education, for the research, for the community services. We combine these activities. We can see that 71% of the student, they make media in the educational poster format. So it's the most favorite media for the student. They develop it, the poster. Then for the 14%, they make essay. They post it in the blog, in their Facebook, Instagram, this kind of thing. Then 30% in the educational video. So they make like short video using TikTok, using like short video in the YouTube. They post it in the social media. And the last one is 2% podcast. Yeah, slide. Aprilia Anggi, you can ask question through the chat, okay? Then for the implementation itself, it's not easy. That's true, what Prof. Gandes said. So we have like coordination meeting and then set up our goals. The core team really work hard for it. So for me, I have to coordinate with the Zoom meeting with all stakeholders, the dean that support us, the core team itself, then the student assistant to contact the student, and also the community itself. We have to contact all of them and coordinate and share our goals and etc. We have a regular meeting online through the Zoom twice a week. You can imagine every Monday and Wednesday morning we have meeting. Then we evaluate the progress regularly. Yeah, slide. Yeah, this is the example. You can access our channel also in the CFHC, IPE, FKKM, KUGM, Instagram, and also you can also search in the YouTube CFHC, IPE. You can find the student really post their idea in that social media. So actually, you can see that the student actually able to join this program for their benefit as like academic activities, and also they can give like community service through this social media platform. You can see that now it's trend. People have social media like Instagram, Facebook, and everything. So I think it's really inspired for all of us to really use that social media to reach the people in the community. Okay, slide. So the result show that we succeed. In 1 month, we can reach like 794 educational media. Is the form like a poster, video, essay, podcast. It's like 100% achievement from the first year. You can imagine. But we struggle every week. We promote, we contact the teacher, we contact the student to promote this program. It's not easy. Each student have to upload their educational media and tag this tag. You can see in the slide CFHC IPE tahun pertama, okay? CFHC IPE year 1, then CFHC peduli COVID-19, CFHC lawan COVID-19. We use that hashtag. Sorry for the international audience. This is in Indonesian. So, but you can check. I'm not lying to you. It's real. They really give promotion to the community. Then you can check also how many viewers. You can check how many comments, how many questions, and how many likes that they got from this social media. It's really true, right? Yeah, but I would like to share you the challenge. Okay, so first of all, we got resistance from the student, teacher, and the field supervisor. Everybody busy in this pandemic. You can feel that when you run this program. Okay, so please, you can try this program. Then you can feel this first challenge. Provide interesting and update topic for the communities. You can see that during this pandemic, every week emerge new topic, new issue, new hoax in the social media. So I think we can use this program to against that hoax, and we can use to strengthen the topic. Even we have to update the topic, because you know, like hand sanitizer, masker is not update anymore. So we have always to update the topic. And the last one is about the monitoring and evaluation. We have to make like setting up the online platform to assess the student, to monitor the student. So we make sure that they will join this program appropriately. Yeah, slide. Solution, we have like Zoom meeting twice a week to monitor the student, and we use like this Instagram HPUUGM as a resource, a content source. So if you have like this kind of platform from your university or from your institution, you can use this kind of formal platform as a source for the student. I think will be nice, because we support this platform, and also make sure the student have like formal resource to share the information. And we have to develop online and mobile app for monitoring, assessment, and evaluation. It's like 30-60 degrees evaluation. Make sure that everyone give comments. Then it's not easy program for the reflection. We have to organize and the team should be committed because it's not easy. Then we can realize that the program able to give huge impact to the community for the education, community service, and also we can get the data from the audience. This is very nice. Then we can share the benefit to everyone. We should make sure that everybody get benefit from this program. The teacher get benefit, student get benefit, institution get benefit, and also the community get benefit. Yeah, slide. Okay, that's my sharing about this program. I hope you can like participate in this webinar, give some question, and we can collaborate through the action after this. If the host able to show the question during my session, will be nice. Or Prof. Gandes question, short question maybe before we continue. To the next speaker is Prof. Siraj and Vishnu from India. So we have 4 questions. So maybe I will read the question shortly, and please some the speaker you can respond it shortly before we continue to Prof. Siraj. First question about from Dian Nugroho. Thank you, Dr. Dian. How to facilitate KKN? It's like community activity if each student is located separately. So we sure that in KKN student have a different location. Anybody want to give a response? Prof. Gandes, Prof. Siraj, or Vishnu?
Right.
Yeah, okay, Prof. Gandes, please.
Can I start? Yes. The first question is how to facilitate KKN if each student is located separately. So this is a different question with what we talked during this webinar. KKN and our institution actually organized at the university level. So the faculty supported, but it is organized in a university level. There is a specific unit that take care KKN, community services. Community services or KKN is really more multidiscipline rather than our program because it involves students from different faculty. As far as I understand, during pandemic, there's also adaptation of KKN because of the decree from the rectors, and our condition is also gradually moving from, for example, you have to be aware until everything should be done online. So in the first period of the pandemic, those students that's already in the field still there. So it will prepare for student mobility. But after the condition is getting worse, I think most of them already asked to come back to the campus. But there are also several adaptations. For example, that they are asked to give education to the community with online, as well as also to join for tracking the patient as well. I mean, for the COVID patient. The second question, how to objectively evaluate the student activity using WhatsApp group. I think this question also relate with the fourth question from Dr. Jimmy. So I think 100% objective is not easy, but we have rubric to do that. What we assess in a rubric, this is the supervisor and field instructors that assess, is the activity of the student, whether they contribute to the conversation during the WhatsApp with the other student, as well as with the partner family, as well as with the supervisor. whether they are proactive, whether they have idea, creativity to make the online education run well, whether they respond well when they are needed, and so on. So there is a rubric. If you want, we can share as well the rubric, but before the program started, we already discussed and make the rubric. The third question is, it's not about community-based, but it's about the campus laboratorium practice. Yeah, okay, the practical session. Actually, every department make their adaptation, but basically what we ask for the department to do the practical session is that if they can provide video, how the teachers do certain step, and then the student can see the video, and then there is a discussion session. So in the very first week, when we are still allowed to go to the campus, but in a limited number, under 50, there is a period of that. Some of the teachers come to campus making video to prepare it. But when we are not allowed to go to the campus again and more limited to go to the campus, we use our previous video that already provided before the COVID to adjust for the practical session. And we also try to encourage the teachers to differentiate what is the aim of the practical session. This is to deepen the knowledge, or this is to drill the skill. So it's different thing. If this is to deepen the knowledge, so it's sometimes it's more easily. But if this is to train the knowledge, there is a team that also provide a guideline. Although they are outside the campus, can they practice, for example, to themselves, can they practice to the family, and so on, and then video it and then upload it. Yes.
Okay, Prof. Gandes, thank you for your answer. I think first question about how to continue in this program, especially for the theoretical things, skills, clinical skills. We can use the media. I agree with you that we can use like online platform like a WhatsApp group, like Zoom, that kind of thing. But especially for the clinical skills, we have to aware that we need like video. We ask them to perform that and using their mobile phone to record their performance. Then the supervisor are able to see that. I think that's like a DOPS format, like DOPS. You can search that kind of thing that is like indirect observation. We can use that. So regarding during the time, so I think it's now the turn from Prof. Siraj to share the slide and give like 10 to 15-minute presentation. And I would like to also remind the audience that Prof. Siraj will join us till 10:30 because Prof. Siraj have like another session after this webinar. But this webinar will continue till 11 a.m. Yeah, please, Prof. Siraj. Hello, Prof. Siraj.
Oh, can you hear me?
Please, yes.
Yeah, I need to share. You're going to put the slides, or you want me to share mine?
The host will help you. Okay, Dr. Tama, can you help Prof. Siraj to share the slide? Yeah. Please, Prof. Siraj, you can start now.
Can you see my slides?
Yes, we can see.
Yes.
Okay, good morning, good afternoon, or good evening, wherever you are. Assalamu alaikum, and thank you for inviting me for this session. Professor Gandes and Dr. Widyandana and the fellow panelists. Well, in this next 10 to 15 minutes, I'm going to give an overview in the Indian context, how health professions education is slowly adjusting. I won't say adjusted, or it's we are in our 42nd day of the lockdown, and it continues till May 17th and maybe beyond. So many of those things are still not very clear as to what policies are being followed, or it's more of an experimental stage. COVID-19, as it has done for many places, has brought in a lot of uncertainty, even in the Indian context, specifically in the Indian health professions education. So while I give you an overview, our next speaker from India, Dr. Vishnupriya, will give you what happens at the front line and community. But this presentation is basically to tell you how it has been tweaked to the current situation. Black swan moments are moments of uncertainty. It emerged as a term from economics, not much in education. So black swan moments refer to times of uncertainty, and it is characterized by a sudden change. And it is also characterized by many events that actually cannot be explained using our conventional methods or the methods that we use for scientific inquiry. So I thought of, finding out whether, COVID-19 was a black swan moment in health professions education. So in one of the webinars that was basically intended to talk about educational leadership during COVID, I posed this question to nearly 300 odd participants and explained the concept of black swan moment. And I asked these health professions educators, they were predominantly medical educators, a few from dental, allied health, nursing, and so on. But it was interesting to see that around approximately 90%, 89% precisely, medical educators and health professions educators identified the COVID-19 outbreak as black swan moment in health professions education as far as India is concerned. So that explains the perceptions of faculty. We have not done in the students. It could be much more because anecdotal responses show that there's a lot of uncertainty among students too. So it is in this context that I'm actually sharing the responses or sharing the modifications or adaptations that have happened, primarily looking at the most important stakeholders. Well, for the students, it has created a lot of practical and logistic challenges, whether it is pre-clerkship or clerkship. It has created a number of challenges in terms of logistics and in terms of the delivery of the curriculum itself, because all medical schools have shut down and undergraduate medical education is only happening through online mode. So it brings challenges associated with that. The main concern has been lab postings, simulations, There has not been a comprehensive approach, which in terms of policy, because we are still trying to battle COVID, as to how we are going to face this. There are discussions going on. There are plans to, I saw one question, very pertinent question that was posed just before this, asking how do you bring them to the labs, right? So that is one thing. And we also have an issue that is a major concern, because you can't bring in your student at this point of time. There are ethical concerns. Though our residents and interns are there in the wards battling COVID, deferred clinical sessions are a matter of concern because it actually directly impinges on the clinical competence. So I said deferred, so we are going to wait and see when it's going to be, implemented. And the current scenario or the current curriculum that we follow from last year actually gives a lot of importance for early clinical exposure. So these are the aspects that have to be attended very soon. So if those were the challenges, we had online learning environment being ushered, or it ushered in as one of the side effects. Whether it is a boon or bane, we need to evaluate, but online learning environment is something that was immediately pushed into the pre-clerkships and of course, even later in clinical years of providing them different learning formats. And we saw that in the last few weeks, there was also a movement to drive assessment becoming online. There are also active discussions on telehealth environment, which otherwise was not, it was only confined to certain areas, and also electives based on student experiences that they have here. Because some of them do volunteering at this point of time. But we should understand that there are ethical issues because, as I told you, undergraduate medical education and health professions education is largely online. You can't force your student out there to go at this point of time because there is the risk of infection. And you would have listened to or seen many instances where people are rushing to give them certifications to see that you have adequate workforce. That has not happened here. And in terms of making it early, because that itself also brings certain ethical issues. Are you certifying people who are fit for practice and things like that? But that hasn't happened here. But all these things, there is a need to evaluate the outcomes. We haven't done that, honestly. Because we may have a few pie charts and bars to display those in terms of what students told us. But in a country like India, huge country like India, I should say, with diversity that we have, and with around 600 medical schools and allied health institutions and nursing institutions, what has happened experimental needs to be evaluated very scientifically. So that's about my student population as such. Now coming to faculty as such, in terms of faculty, for many of them who were frontliners and for people who actually were treating patients having COVID, it was professionalism redefined. Because you know that based on professionalism and altruism and things like that, patient comes first, and even if you are sick, you should go and see the patient, right? But then with the entry of COVID, it had to be redefined. You cannot go and, if you're ill or if you're suspected to be ill or if you're quarantined, there's no question of seeing a patient because you're putting the patient also at risk. So tenets of professionalism grossly got redefined. And our faculty had to actually pursue an entirely set of new skills, whether it is online teaching learning or whether it is online assessment. There was a need actually to procure all those skills in a very short time because institutions said we cannot keep waiting, we need to go online and things like that. But having said that, the brighter side was actually providing people avenues for scholarship and also provide evidence as to whether it is working or not. So that was a brighter side. But for many of us, with moving to online, managing things in medical school, and then rescheduling the entire thing, and then of course also taking care of other aspects, things have been much busier than the usual. If you had worked 8 hours pre-COVID, many of the medical educators and professionals, health professionals, work more than 12 hours now. So that probably may be because we are getting used to many of those things. It's for the first time that we're doing. These boundaries are getting redefined, and there is, as you know, there is always stress, burnout, and other issues that come along with that. This is again something that is good that has happened, because with COVID, though it's a viral outbreak, the virus should be actually given the credit of bringing people together. For all those who thought that they could manage it on their own, the virus taught a lesson, and there was a need to actually go across and learn from people. Whether they belong to developed or developing, it did not really matter, right? So novel networking. So that's what those are the things that happen for faculty. Now, I will use one of the very popular frameworks that I used specifically when you use for decision making, the Kahneman Framework, for explaining as to how things fell in place. And this again in the webinar, one of the webinars, we asked our health professions faculty as to where do you can see that there are 4 places as such, quadrants, and then in between is disorder, because you need to decide where you will move, right? Now, it was not a surprise that only 5% said that even post-COVID, when you go back, your educational environment is going to be simple. Rest 95% of faculty place them in complicated zones, complex zones, and chaotic zones. Around 35% maybe in complicated, around 32 or so, and maybe the rest, if you even said that they are in chaotic zone. Now, if you have an idea about complex adaptive systems and how you have got to decide, it's based on this. So when we did a survey with our faculty, when we saw that around 90% of them said that it is not going to be simple again, then we thought that we need to classify those faculty development activities, or how are we really making our faculty ready for this situation, specifically in terms of the disorder that we have seen, in terms of the chaos that we have seen. Well, I'll take up the first one for people who said it is simple. Well, I often use the metaphor, the crockery shelf that we have. We have kept those crockery out there. We have all e-learning solutions. We have learning management systems, but most of them had just been kept like this in the crockery shelf, never used. Once in a while, if you have a guest, maybe I would say the accreditation guest, you pull out and show them, right? But when it comes to a situation like COVID, that is where you're going to use those things that you are already having. So that is a simple, I said, the first quadrant, where you have the best practices already there in some schools, but not used extensively. So that is a place where I would say that nearly 20 to 25% of these places did have all those facilities, but hardly used in terms of it. So that's what the situation brings in, of using those tools, whether it is e-learning tools or learning management tools. Now, in terms of complicated ones, to the next phase that we have, is we actually took charge as an academy. We have an Academy of Health Professions Educators, because as I showed you in this diagram, the complicated ones, what really needs to be done is good practice. So you got to pool in the resources that you have. I'm just showing you one of those. We've been doing extensively webinars and doing, walk the talk, actually, and engaging our faculty in helping them to teach online, to assess online. So that's where we stand in terms of the second quadrant. Now, if you go to the third quadrant, where people assess themselves in a complex situations, if you see the first two, the simple and complicated, you have a cause-effect relation. It's easy. In simple, it's very obvious. In complicated, it takes some time. That's why you give it to the experts. That's why the academy takes up and brings in experts and then give it to them. Complex is not like that. You know, it happens in hindsight. So retrospective, you really don't know whether it's going to work or not, but you try it out. You may not be able to get the same results if you're going to use the same protocol, but then we had to take a chance. So if you look at the complex ones, that has been largely having networks and then conducting, sessions with them, exchanging knowledge, consultations. We don't know as of now how much of this will bring real impact, but it is sure that there will be some forms, but evaluation not done. But the most interesting aspect will be the complex aspect of it. Since we, I'm sorry, deal with interprofessional education and practice, the complex ones that we see are basically, you don't have answers for that. But most of the innovations, radical changes actually happens in the complex environment. So I have put here the National Center, Nexus, for who are working in interprofessional education. You know, it's an US-based organization. The same framework actually to see what is happening interprofessional, because in this time of turbulence, it's not much possible to do this because your experts, your consultants and clinicians are battling COVID out there. Your undergrads are still there online. Residents are working there. So interprofessional education is happening and practice is happening, but not in the framework, a predetermined framework as the previous speakers actually showed you. So we are in a process of asking people, how are you supporting learning about interprofessional practice and teamwork in the current environment? What resources would be most supportive as you transition to the new models of learning? We don't have answers. So that is exactly the complex situation, the chaotic situation. But the hope is that it will bring in innovations. And most importantly, what conversations would you like to have with colleagues facing similar circumstances? Within the profession, and of course, outside it with allied health professionals, with nursing faculty. So this is evolving, and we have no answers at this point of time. To conclude, I should also mention that what has to be very strong in the time of COVID is the academic leadership. C for COVID, and it is not a coincidence that most of the qualities of academic leadership actually during this pandemic starts with C, whether it is being calm or showing confidence or having conviction or relentless communication, whatever it is. But I am more interested in the C that starts with communities of practice. So as we do today, it's very important to actually bring people under an umbrella who share the same, vision and who would like to actually battle this pandemic as a one community. So that is the most important thing that is inherent to the systems that we practice, and it is important to follow that. Thank you so much for your time.
Thank you, Prof. Siraj, for your share. It's very nice. Before continue to Vishnu, I would like to greet the audience that thank you for your comments, your question in the chat room. So it's nice share over there, I saw. Then if you have question special for Prof. Siraj, please mention in your question, because Prof. Siraj will leave 10:30 because
I need to leave in 5 minutes. So
in 5 minutes. Okay.
Yeah.
So if somebody have special question, Prof, for the Prof Siraj. Please give your question now. We have time to see what the question. So during this webinar, we talk about the community activities during the pandemic. Then we have like 90% of the audience have this kind of program, and only 60% of the audience continue the program through the online platform. So we have like 30% audience that not continue the program. So let's check the chat room. So is there any, or maybe the host able to show the question from the for the Prof Siraj? Then yeah. So this the question that comes in. So about the monitoring process, about the assessment process. Maybe Prof Siraj, while waiting the next question, you can respond about the tips or strategy about the assessment or the evaluation for this program during this pandemic for the audience.
Yeah, how to monitor students during exams. This is more of a general question. Can you hear me?
Yes, yes, please.
Yeah, this looks more of a general question as to people are really worried when you have online exams, whether cheating could happen, or how well it's being controlled. So one of the ways is actually the time-tested method of having a big pool. The questions have to be from a big pool, so that the issue of addressing validity and reliability to a large extent has. And second one, of course, is also having questions of higher order. If you're going to ask a recall question, you will have the problem. You should ask questions where students need to think and answer. Now that is one aspect. Now coming to the technical aspects of it, many of us know that MCQs and EMIs or EMQs, that is extended matching, are good. So those questions taken from a big pool, actually there are now very easily you can do the reshuffling of items. So even somebody is sitting next, you can't really, because you have fixed timings given actually. One is the reshuffling that happens in terms of the questions. Even the responses can be actually shuffled, right? So, and also, I know there are medical schools which ask students to keep your webcam on during this, there are online proctor systems, but they're very expensive, and I don't think that many of us can afford. Most importantly, it will be the professionalism and ethics part that you and me will have to inculcate in a group of students to tell that you're going to be budding doctors. You can't cheat during exams, So these are my views. I don't know if Professor Gandes wants to add.
Yeah. Prof Siraj, can you also respond about the question from the audience about the limitation from the field, that maybe the internet connection have a problem, they have no electricity, maybe that kind of thing. Can you respond on that question?
This is a real problem, because we have some places where there are issues with bandwidth. There are issues with. I was reading a UNESCO document which says that around 70 crores students, that includes also school, I believe, without internet connections also. Forget about the penetrations and things like that. Now, these are systemic issues that needs to be addressed. If you really want to e-learning to be the order of the day, and if you want to actually replace it or at least supplement, this has to be largely initiatives that have to be coming from the government. So in our case, government is proactive and is trying, but the equality is something, I agree to Dr. Arif who has asked this, it is present. And the equality, equity in terms of, the inequality, that's what I'm trying to say, is going to widen with the COVID. So we will have to see that, as institutions, as governments, that before we implement all these things, large scale, that systemic issues will have to be addressed. And I agree with Dr. Arif. These are concerns to be addressed.
Yeah. For the last remarks or your idea for the audience, Prof. Siraj, before you leave the webinar, maybe, please.
Yeah, I would have loved to be here, but I am going to take an online class within 15 minutes to 132 students who are in Malaysia.
Yeah.
So, I would have loved to be here. I'm sorry that I have to leave, but thank you so much for inviting me. And to more specific issues related to care, delivery, and community, I'm sure that Vishnupriya will address those issues.
Okay, thank you very much, Prof. Siraj. Really appreciate your times and your share during this webinar. Of course, all the audience really thankful for that, and that's very useful for us and hopefully also for the community. Okay.
Thank you, Professor Gandes. Thank you.
Thank you, Prof. Siraj. Bye.
Bye bye.
Okay, bye. Okay, now we continue to Vishnu. Please, Vishnu, you have 10 to 15 minutes to share your idea slide in here. Tama, can you have, oh, Vishnu, you can share. Okay,
yeah,
thank you.
Okay.
Yeah, please.
So, yeah. Hi, everyone. Good morning from India. I know that we are going through a very difficult phase. The times are not that pleasant. Still, just hoping for the best and acknowledging the effort of our global community. I wish a very pleasant, energetic, and productive day to all of you. Apparently, as you can see, I am the youngest member in the panel. I am actually working as a junior doctor in clinical research, and I'm in the second year after my graduation. So as a speaker, I think I would like to consider myself here as a representative of our community, like the community of the students and the young healthcare professionals. And I think the perspectives which I would like to share would be synchronous with the voice of the young and the future healthcare providers. So to begin with, maybe just a quick outline of the context, like the system of education that we have in our country, the system of education we have in India. So it is like, and just to let you know, where do we actually fit in community and community-based education. So the model that we have is not like a complete shift of curriculum delivery into the community. So it is like incorporation of the community health topics into a subject, which we usually have as community medicine, usually comes in the third year of our undergraduate studies. And I have to say, like, excluding a few institutions, maybe in a vast majority, the exposure that the curriculum actually offers, like once you get to know about the community after the initial sensitization, the exposure or the freedom that the curriculum actually offers for the students to maybe establish a continued relationship with the community, maybe work in collaboration with the students of allied health sciences, and more importantly, ensure its sustainability, it is kind of a bit restricted, or it's kind of a bit limited in India now. And as of now, most of the times the focus is mainly on hospital-based patient care. So that is just a quick outline of what we have in India. So now let's see how we can sort of connect the dots with the picture of the pandemic in a realistic and a pragmatic way. And I would just like to discuss or share my thoughts under three headings, or maybe like three questions. So the question one would be adaptation. So adaptation of community-based medical and health professionals education. How about the international student community interpreting it or translating it as rising to the occasion? So which I think would be the need of the hour. So what do I mean by this? We know that this is about making us equipped or making us capable enough to have the skills and then utilize it in an effective and productive way, like engaging community, as well as tailoring it according to the needs of the community. So I think in the current situation, adaptation of community-based education should mean to a student, it should mean the ways by which we can maybe take the textbook knowledge, take it, translate the experience that we have gained and put it into action in a practical manner. I think that is what the situation demands, and deliver it to the community in a beneficial way. So I think a couple of ways by which the students can actually utilize their skills, or I think maybe the institutions can actually involve the young workforce, maybe students in all undergraduate years, clinical as well as non-clinical, would be. Number one would be a dissemination of information. We know that social media plays a very important role these days and in sharing information. And it's important to ensure that the community is actually getting genuine and credible information about the pandemic. So students can in fact play a very positive role as like by creating an impact, like they can be as educators to their peers, to the patients and the communities, using the tools that we have through social media. And, I think it can definitely help influence their behaviors in a positive way, like the importance of social distancing, the need to wear masks, washing hands, the proper methods of hand washing. Maybe we can translate the authentic information, into local languages and distribute in the form of online posters and WhatsApp messages, as well as creative and innovative videos. I think visual media plays a very important role, if you want to convey a concept. So maybe creative and innovative videos, which can convey the information in a simplified and interesting manner to the community. This can be done maybe in collaboration with the community leaders, people who actually have a good rapport with the people. The second point would be mental health. We know that all of us know that this is a very stressful situation. There is so much of panic around. There is so much of panic among the global community, and mental health is something which at times get neglected, but which apparently is a very crucial element. So maybe providing emotional support to the people, or ensuring that the people who are in need, they get adequate counseling, or maybe just an ear to listen to them, maybe to pacify them, or maybe to clarify their queries about the pandemic. I think here also students can actually take an initiative. They can form support groups, and they can provide assistance to the people, because we already have a set of students in India who are actually taking the initiative for that, which can be done as a coordinated effort with the help of qualified professionals. And the third area would be people with chronic diseases. We know that in most of the hospitals, mostly the regular OPDs may not be working. So mostly in hospitals in India, mostly like we have only emergency services working these days. And so the people who are actually on regular medication, people who are actually taking medicines for chronic diseases, they may not be able to come to hospital for follow-up. But it is important to ensure that, the people who are in the community, people who are actually having these diseases, they adhere to the medication, or it is important to ensure that they have access to medicines, or if not, it is our responsibility to ensure that, we help them out in this situation. So that is also one area where I think students can play a role, which can be done in collaboration with the hospital authorities. Maybe it can be done easily using a telephonic follow-up. That is also one area. Another point would be delivery of essential services. In most of the countries, we are now going through a lockdown phase, and we have divided the zones into isolated zones, containment zones, like hotspots, coded it according to red, yellow, green. So depending upon the number of cases that we have. So it is important that we actually need manpower to deliver essential services to these areas. So this is where I think if students are actually interested, students that can actually volunteer, it would be an opportunity for them to actually work with other sectors, get an exposure of this multi-sectoral collaboration. And I think it can also help in advancing their leadership skills. Like they can take part in activities like maybe distributing groceries and maybe mask collection and donation. And the final point which I would like to point out is this apparently is a crucial time to reinforce the need for a shift from an individual-centric to a population-based approach, and the importance of incorporating the social determinants of health. Because we know that pandemic is not about an individual, and it is not even about a hospital. It is about a community. So the solution that we have to the problem that we have now, it is not an individual-centric or just a hospital-based care. So it can only be done with the collaboration and the coordinated effort of the community, of the students, of the health professionals, of medicine, as well as other allied health sciences. So I think this is a time where institutions should actually make sure that we enlighten the students. I'm pointing it out because this is at times lacking in many institutions in India. So it is important that we enlighten the students about the complexity of the situation, and it is time to emphasize the pivotal role of integration of medicine and public health. So those are the 5 quick points which I wanted to share about the adaptation. Now coming to the reality, the previous slide. So what have we done? How have we responded to the situation? And what is the biggest challenge the community is facing? And what is the action that we have taken? We know that this is kind of an unprecedented situation, and which has actually disrupted the educational structure. And that is the biggest challenge the students are actually facing. And we don't know till when, we don't have like a specific, we cannot give like a specific time period. Okay, fine, till when is this going to be like this? So as a student, or maybe as a graduate, just graduate, I think I have to say the first and foremost thing that we should be able to do, or the students should be able to do, should be the acceptance of the reality. I think that mindset plays a very important role. So it's important that we understand the seriousness of the situation. And we train ourselves to make the best use of the alternate available resources, which we right now have in the form of online classes. And about that, we already had a discussion. So, and we know that it cannot actually compensate for the hands-on experience. Of course, it cannot actually match with the experience that we get with a live patient. But at times, mannequin simulators are found to be effective in maybe in some studies. But I would like to stress that the students should understand that the situation actually is demanding a flexible and practical approach, and we should try our best to adapt to this, and we should be the online classes. I think it's important that we understand that we should try and put our best effort and make sure that we are utilizing what we have now in the most effective way. And another thing would be like in some situations, some institutions in India where we have started doing it only, but not everywhere, like involving students in telemedicine consultation. In some of the hospitals we have, instead of the regular OPDs, we have telemedicine consultations going on. So maybe it would be beneficial if the students who have started their clinical years, if they can be a part of that, it would maybe sort of to an extent, it might help them to compensate for that lack of clinical exposure that they are facing these days. And the front line, we are a bit hesitant to actually make the students work in the front line, because a big problem that we are facing is a shortage of PPE. Even the residents in India, we are actually having there is kind of a very shortage of personal protection equipment. So apparently because of that, as of now, we haven't actually made plans to make sure that the students in their undergraduate students can also actually work in the front line. But yeah, because of this acute situation that we're actually having. So yeah, so I think it's important that we think about the alternate ways, and and just make sure that how we can channelize their time during this situation. And another thing would be like the need of this hour, or the situation also asks for like educating the students, not just the continuation of the regular subjects, not just the continuation of the regular undergraduate subjects. I think it's also important to enlighten them about the pandemic in addition to their regular classes. That too might be in place in some institutions, but if not, I think maybe an online pandemic curriculum, which can sort of help the students understand the multidimensional aspect of the pandemic, and correlating the responses from people who are working in the front line, and giving them examples and how they are actually maybe like a day-to-day scenario of that, and making it a live interactive session, giving them projects coupled with quizzes. I think that is something which is very important, not just in the current situation. Maybe if we are facing similar situations in future, I think it's important to sensitize them how to actually respond to, how to, once they are becoming the healthcare professionals in future, how should they respond if a similar situation arises. And just to note what is being done in my hospital, in the department where I work, we work in patients with systemic lupus erythematosus. So we are like, most of our patients, ours is a referral center. So most of our patients are actually from very far off areas. So what we're doing is, like, in addition to the telephonic follow-up, we have also prepared a structured questionnaire specific for COVID-19. So we will be asking them about the symptoms, about how safe is their neighborhood, and if they have access to medicines. And if not, we are actually helping them out with the specific agencies that we have in different regions, and making sure that even if they are not able to come to the hospital, and even if they are not able to get access to the hospital care, we are making sure that their health is not actually getting compromised. Now, coming to the future, so how should the path forward look like? For me, I think the path forward should be like learning from the experience. So one experience that we have learned, one experience, which I mean, one lesson which the pandemic actually taught us is we have seen like a transformation in medical education. So we have telemedicine now. We have actually devised flexible approaches to achieve solutions. So I think we can evaluate and analyze and document the effects of these changes and make sure that we apply and learn and apply these practices in future. And we analyze the situation and see how effective it will be if at all we need to incorporate it. And the second and the most important part would be that the pandemic taught us that the community is a pivotal part. So I would like to vision a future where considering community as an integral part, it continues. If in areas where it has not been done yet, I think from now on we'll start taking community as a cardinal point. And the students also realizing that holistic healthcare is not just about hospital-based patient care. That may not always provide solution to all the problems. So it is important that once they actually grow up in the learning process, they should understand that multi-sectoral and intersectoral collaboration is something which we actually, the future should actually witness like a group of healthcare professionals understanding its importance and putting it into practice. So yeah, this is what I would like to share. And the last slide would be just, just like message, like we are all in this together. So we will get through this together. There's like a message to all my students actually, and all the young healthcare professionals who are actually listening to me. So that's it.
Okay, thank you, Vishnu, for your share. Now we will continue into discussion session. So while waiting the host to show the question, maybe Vishnu, you can see that in Indonesia, for me, especially for the chairman of this community activities program, we really struggle to make the student, the teacher involving to this program. How about the situation in India? Do you feel that kind of thing also or not? The student, the teacher reluctant to this online platform. Yeah.
I have to say, like the online platform, I have to say, like it is maybe in some situations, like we have a couple of professors like who are like in the middle-aged people. So my personal experience at my sister, so she's also in the final year. So she was supposed to actually start her online classes 2 weeks back, but they're still having technical issues because the professor is still getting trained. So that is one thing from the faculty, like professors are at times struggling a bit, getting adapted to this, shifting it to online platform. And for the students, initially there was a bit of reluctance. But now I think everybody is slowly getting adapted to that. But what I personally feel would be like online learning may not be as effective as in a classroom atmosphere. I don't think we students will be that receptive, like when we sit in home in a relaxed mode rather and comparing it with sitting in a class. I don't think it won't be that receptive, but I think everybody is getting slowly adjusted to the change. And in the institution where I studied also, like we have, excluding the clinical part, we have taken started all the theory subjects, and the mannequin simulations, it is maybe they are thinking about it, but the theory classes are slowly, we are trying to make sure that till the time we are trying to make sure that whatever with the time that we have, we are trying to make use of the resources. But just some technical glitches with the professors and students now are kind of okay, I think. Yeah.
Okay, thank you. And now we are waiting the host to show the question. Yeah, I saw that in the question to pick a topic that really rising here is about assessment and about the method how to implement this kind of thing. It's like a question from Dr. Mario and Dr. Susana. I think it's almost similar. The issue is about the assessment issue. But the evaluation result, family response, okay, and the small amount family, okay. And but the evaluating skills, Prof. Gandes, can you answer this question?
Right. Okay. Question from Dr. Mario. Yes, as I mentioned in my presentation, there are family. Also, the number is very few to refuse the education, and also the responded for the partner family to complete the online evaluation is 30 something. So there are partner family that didn't complete the evaluation form. We didn't yet do the follow-up action for the participant that didn't complete the questionnaires. But I think we have a chance to do that because they are the partner family. The student will still working with them during the pandemic as well as after pandemic ended. They still their partner family. But until now, we haven't followed up yet.
Yeah.
Okay, then
yeah, please.
the next question. Yeah, the next question perhaps not correlated with a community-based education. It's correlated with OSCE exam. So for the online exam, non-OSCE, we did it. And the way we try to observe whether there will be cheating or so on. So we have some staff, and then the study program divide the staff. One staff observe several number of the student, another staff try to observe online the other students. So this is the way to make prevention from cheating, for example. From the OSCE exam, so it's really depend on the context. For example, in pediatric for the resident, because the number of the participant is still very few, so they still do the OSCE physically, not online. But all the prevention for COVID-19 diseases is done, is followed. So from the temperature checking, for the hand washing, the physical distances, not shaking hand, and so on and so on, and then try to arrange the distance between one station to another station, try to arrange that between participant and other doesn't meet a lot. So all the protocol are done. So it's like still a traditional OSCE, but using all the protocol of COVID-19. And I also see that there are practice of only online OSCE examination. So it's all the question delivered through online. But again, because this is online, it's not like you do directly to the patient, but there are questions accompanied with a picture, video, and so on. Yeah. However, perhaps I can also a bit share about, like, for example, doing mini CX and so on of our students. Some of the students try to to practice it with their family or their friend, and then a videotape, like Pak Doni said, and then the teacher can give a question, something like that. Yeah.
Okay, thank you, Prof. Gandes. Maybe as a person that chairing this kind of activities, I would like to share also about how we organize this kind of things. It's really challenging. So I think it's better for us to form a team. So we ask somebody that knows about the IT, about the how developing the media, how to use online platform, that kind of thing will be nice to ask them to join our team. Then we can form a team that really have like commitment to encourage the student, to reach the student. So we can also recruit the student assistant to help us reach the student. And for the teacher itself, we have to encourage the institution to share the reward and to share the rules, how to join and contribute to these activities. I think, well, when we have like a solid team to control all these activities, and keep monitor the progress, how many people involved, that kind of thing. And based on my experience, if we have like twice a week evaluation, I can reach all the students around 1 month. So that's I think is quite good. So it gives pictures to all of us that conducting this kind of online activities that give something to the community, continue our program, modify the program, need times and need this kind of close monitoring. And I would like to share about the tips for the assessment itself. We can use online platform that like a Mada, that they provide like we can have like a question bank, like 100 question bank. Then each student then assess that. It give like random question that show up, like 20 question. They randomly give that 20 question. So we make sure that all students cannot cheat, that kind of thing. We should aware about this situation, because you know the student is very smart. They try to cheat the program, they try to cheat the assignment, that kind of thing. So we should aware with that and make sure that we keep focus on our goals. What actually our goals? The competency that we reach for them. So it's about theoretical thing, skills, or maybe like more focus goal for our program. In our program, focusing on community services is response for the COVID, and we try to elaborate our assignment to fulfill their their activities during this COVID. So they have, the show must go on, right? So we need also mark for them. We need to conduct the assessment system, that kind of thing. So we modified a lot of things. Question, maybe can the host share the next question, or maybe the previous question that never been answered before? Okay, this about the monitoring the student during exam. I think we cannot monitor them directly, so we have to modify the online platform to make sure that every student get like that kind of random exam. Or I think it's good for us to actually assess the outcome. So if we, for example, for us that asking student to give like to develop online media to help the community for the head promotion, that kind of thing. So we measure that how many people assess that, how many people give comments, give question, how many likes, that kind of thing. That would be nice to encourage students to really reach the community. So that kind things I hope able to give us idea. Any other response from the speakers, Prof. Gandes or Vishnu?
Yeah. Yes, I think for question number 6, you already explained. Question number 8 about the availability of Wi-Fi. I think Siraj, Prof. Siraj already also answered it and share it. Can I add something regarding the question for number 8 from Dr. Arif Wijaksana from Tanjung Pura University? I do agree that it is difficult situation. Once I had one of our group of students did community service in the area of Asmat at Papua. At the time, we also face difficulty to communicate. So when I send a message, 3 or 4 days later, just receive back. It was far before pandemic, but just showing that it was really difficult. But when I ask something to the student, although they answer 3 or 4 days later, they come up with surprise tasks. So for example, at that time, the student making like a library in one of the places in Asmat, and then show video to me only after 40s I give some question. So what I think is that perhaps this idea can help to handle the issue. So the meeting, the online meeting should not be so frequent because of that kind of difficulty. But when we have a structured assignment and then giving to the student, and then give sufficient time for them to do. So the instruction must be very detailed, so they can do by themselves in their own community, and then check again, come back to you a week later, 10 days later. So they still can do that, but the difficulty for the Wi-Fi access can be prevented, not happen so frequently. Perhaps that's one of the idea. Obviously that the government should put attention to give more facility for more Wi-Fi access. Yeah. However, I should mention as well that the concern about the quota is also experienced by our students as well as our teachers. So this is the reason why we give like 8 assistants to the student. They can register, they can propose that they really need their condition, they really need help to buy a quota, and then we reallocate our budget to help the student. Question number 7. What learning methods used during this distant learning period for activities in the community health center? Obviously, the student didn't go to the Puskesmas, they didn't go to the community health centers. They do everything online. We also have experience with nursing students that collaborated with the health office, district health office, and also Puskesmas to track ODP, PDP, as well as to give education for them and their family and neighbors. So for the earlier student, we protect them not to go on site, but for the postgraduate student, that we have a master student program in a field program that they go there if needed with appropriate protection. Yeah. Okay, so it's very regarding the study program.
Thank you, Prof. Gandes. Vishnu, do you want to add something based on your experience in India? Maybe you can share to us.
Actually, for the 8th question, I have to say it is not coping for the problem, because as of now, maybe we maybe especially for our team, we do have students mainly from almost all the regions of India. So this is one problem which we have problems with the PPE, but this is something which I haven't even as of now heard from anybody. Like all of them are using the mobile data they have. Not everybody depends so much on Wi-Fi. So the mobile networks are actually kind of working as of now, and the students as of now, like the people who are in my team, and also the people who the students even from the northeastern part of India, as of now I think it is kind of okay. Like they are finding it okay, like not because of there isn't so much of dependence of on Wi-Fi, and they're mainly using the mobile data from all the private networks. So for that I can answer it in a positive way. It is, as of now, I haven't experienced it as a big problem and wouldn't like to highlight it as an issue. So, but might happen, and maybe we can actually think of some solutions, and maybe the institutions can actually play a role in that. As of now, we don't actually provide a quota for students like that. So, like it is mainly their personal network, and what the like institutions, unless and until the students are in the hostels, they don't usually have access to the Wi-Fi. And so as of now, everybody is using their personal mobile data. As of now, it is not an issue, but maybe we can actually think of some solutions when we actually face an issue like that, just like the issue with the PPE. Like we are trying to find some alternatives, trying to find some other ways to get the mask homemade, and maybe the hand sanitizers also. So I think when the situation arises, we'll definitely think about it.
Okay, thank you, Vishnu, for your response. We have two questions from Dr. Irwin and Dr. Fundi about the KKN and about using the video. Maybe I will respond to Dr. Fundi about using video. We can see that in this online program, work from home program, we can see that a lot of internet quota we use. Then I think it's better for the institution to think about this, and we are glad that Gadjah Mada University support the student to get like have some money for the quota to make sure that everybody able to access our platform. And we can also consider about this kind of thing, about the using video, using like a direct meeting that require everyone join in the same time. We have to modify that. So in my personal opinion and my personal experience coordinating this program, we should have like plan A, plan B, plan C, that kind of thing. We give alternative to the audience, to the students, to able to access our program from several choice. Yeah. They can use like email, they can use WhatsApp, they can use like Instagram or social media, and we can ask them to have like alternative solution. We give them alternative solution if they have that kind of difficulties. Yeah. I think we have to consider that some people maybe have difficulties managing their time, managing their internet access. So we have to give them like several choice how to solve that kind of problem. And we can see that in based on Gadjah Mada experience, we have like around 5% of students cannot be accessed our program. So still for the year one, we have like 100 response, but for the year two and year three, we have like 5% student cannot access the program. I think it's not a huge amount, but we should consider about them how, and we have to reach them to be able to follow our educational activities. And for the KKN program, yeah, I think we should consider for this pandemic COVID, we can see that every week the government have like different policy. They modified the policy because now the impact is not only for the school itself, but for the disease itself, impact to the health services, the disease itself, the lockdown and everything, the PSBB policy also impact for the economic level, and also impact to our psychological things like make the student stress and that kind of thing. So I think we have like consider about that kind of things, that it's better for the team that organize this kind of KKN online, or maybe uh, responding to this Dr. Irwin question, that we have to modify this kind of learning activities, but make sure that we consider all that kind of aspect. So how to deliver the assignment to the student, how to monitor their process following the question, how to evaluate the impact to the community, the family, that we should consider this is equal, or maybe close to be equal with our curriculum. Then the last thing we have to consider about the how to assess the program. So I think considering the goals of the program, then match to the assessment of the program will be nice. And one thing that we should aware, that we need somebody that really know about the media, really know to how to optimize the media, online platform, using mobile application, that kind of thing, to help us to find the solution for us. Any addition from Prof. Gandes and Vishnu, please?
No, I think that's enough.
Okay. maybe the host able to share the link for the Google form that we developed together. This Google form, we try to make to give the link in this Zoom meeting, but the Zoom cannot accommodate that. So please, you can write down the link. Then you can sorry. Yeah, you can write down the link. Then you can participate to this Google survey form. That we will try to help each other. We will collaborate Gadjah, Mada, UI, IMERI, and also the other university. I think will be nice if we can communicate and we can inspire each other to run the program. As we can see from the pool, we have like around 90% audience that have this kind of program, and only 60% audience that continue running the program in the community through the online platform. So we have like 30% of the audience that still cannot continue the activities. It's now almost 11. So Prof. Gandes, do you have remarks? Because you are the Vice Dean in Gadjah Mada. So in that kind of policy maker, what kind of thing, the challenge that maybe you can share to the audience, please?
Yeah, thank you very much. I think the tension is always in the two directions. The first direction is that how to make sure that the student can achieve or reach the minimal competency we set. The other direction is that it should be done by online, or at least for the clinical, for example, we have to make sure the safety of the student. So between the direction, we have to work so carefully. It will not be ideal. This is not an ideal situation, but we have to be brave enough to make a decision that based on careful planning and also close monitors, evaluate, and ready to change anytime. Because we also don't want to delay so long the student. It's not what the student expect as well, but we also understand that the situation is not ideal. So we also have to provide a safety net if what we plan cannot be done as we plan. So that's, I think, one of the issue that concern us during the COVID pandemic, either for the academic context, either for the community contact, as well as for the clinical contact. But for sure, we can do. We can change. We need to change our perspective as well. And I think the student is the great sources to talk to and to ask their opinion, their experience, and then use them to improve the exam.
Okay,
Yeah.
thank you, Prof.
Thank
Gandes. And for the Vishnu, can you share something based from the maybe like student views or maybe fresh graduate views about this kind of situation? Why they cannot assess the platform? Why they have like lazy maybe to assess the platform, join the program, that kind of thing, based from the student or maybe like fresh graduate people like you? Yeah.
Okay, so I would one thing which I would like to mention about this online learning program is like, since I have been part of a few, because I'm also always sharing it from my personal experience. Like I've been a part of a few, and at times the amount of effort that we may put in when if it is an online session compared to when it is a classroom session, it's comparing it. I have to say that online session might be on a on a little lower side. That is something which I have experienced, and maybe a few of my colleagues and maybe some of my juniors might also feel the same. But right now, since we do not have any other option, I think everybody is trying their best to make sure that in spite of all the frustration, it is kind of a bit tedious thing, when we are actually sitting at home, and more importantly, it is kind of a relaxed atmosphere and, able to concentrate when there are so much of other activities maybe going on in home. I don't think it is so much of a good facilitating atmosphere for an effective learning, but still, since the situation is actually, we don't have any other option, I think everybody is trying their best to sort of adjust with that, trying to keep the frustration away, and they're trying their best to sort of cope with that. And one message, two messages which I would like to share here is like, we are the students, be it medicine or allied health sciences, we are also like budding healthcare providers. And I think which is apparently an opportunity for everybody, like to actively participate in sort of helping the community. And I think we shouldn't actually consider them as people who do not have so much of experience. I think this is a time when we should also consider like their efforts, one situation where their efforts can be valued or should be valued. And I think it can definitely help inculcate qualities like, that the skills to work in crisis situations, and maybe more of a solidarity to the profession. So I would like to say, like, if the students are actually interested, and if they're actually they want to volunteer in playing a role in this, they should actually be given an opportunity to do so. Maybe like the things that they can actually do, which can maybe sort of help reduce the burnout of the frontline people. So like keeping the safety as the primary concern. And another thing is like, just again highlighting the situation, because what we are facing is like, just keeping that in mind, I have to say that the education that we are providing now, and the education that we are providing to them, be it in the online form or be it with a virtual patient or be it a telemedicine, I think it is important that we are actually making them capable enough to once if at all a similar situation arises in future, I think these are the people, the students today are the people who are going to work in the front line tomorrow. So I think the education, whatever we are giving now, should be in a way that makes them capable enough to not to be in an uncertain situation, but to act effectively and to act vibrantly once they are actually taking the lead in future. I think this is what the pandemic has taught us, and this is what we should learn from the pandemic. And yeah, this is all I would like to say. And yeah, just about the online learning, I think I'm a bit skeptical about that always, because I know how it would be. So but let's see how things are going, and the students are sort of getting adapted to that. Still, I know, like I do receive messages every day from my friends, like, okay, we have classes today, I have to sit for another 2 hours. Would have been better, maybe I would have learned better if it was in college, but I'm finding it difficult. I'm sitting home, and when there is so much of other activity going around, it's a bit difficult for me to concentrate. But still, since we don't have any other option, we are actually trying our best to adjust with that. So let's hope that things get sorted out soon, and we can actually go back to the clinics and get the hands-on experience.
I still mute. Okay. Thank you for Vishnu from India and Prof. Siraj from India, that representing from the TUF. Yeah, thank you, Nadia, for sharing this slide. So we have like 2 big events will coming. So this year, you know that we have TUF. It's like network for the medical education and for the health services, especially in primary care, how promote the education and health services. This TUF network actually is like big organization worldwide. Now, Gadjah Mada is one of the member of this TUF network, and we already like 20 years join this network. So this year, the conference for TUF 2020 in Mexico, and will be done online. So it will be conducted online conference. And we are glad that TUF meeting 2021 will be held in Yogyakarta. So Gadjah Mada will host this meeting for us. So it will be good opportunity for us, all of us, to join this meeting and collaborate with our medical education organization in Indonesia. So this webinar also linked with the TUF regional organization. So I would like to greet all international participants during this webinar. Thank you very much for your coming. And we want to share this information to all the participants about this TUF network, TUF organization, and also we would like to share that FEMER also already we have like FEMER regional center in Indonesia. Now in Gadjah Mada we have friendship that able to represent FEMER Philadelphia. So I think it's big opportunity also for us to collaborate, and also IMERI already initiate this kind of webinar that will be very useful for all of us. IMERI, thank you very much. This very great team organized this meeting, and they provide this kind of webinar regularly every month. So it will be nice for all of us from the Indonesia and also from the international audience to join this kind of webinar. And for my last remarks for regarding the moderator, also the speaker, and also the people that really involved for this kind of activities online, it's really need good collaboration between us, the core team, all stakeholders, to run this program online. So I think it's a good idea to keep communicate to discuss this kind of thing. We give you the link about the survey, and we can join the collaboration through that link. But if you cannot access that link, please don't worry. We will share the link through the WhatsApp group. So everybody maybe have WhatsApp group that correlate with the education. So we will try to share that link through that WhatsApp group, so you can communicate with us. I think that's all. Thank you very much for everyone. It's already, what time is it? 5 minutes past to 11. I think about the certificate, about that kind of thing will be organized like usual. So we will send you the certificate through your email. So everybody that already registered and joined the meeting will get a certificate. Okay, thank you very much, everyone. See you next time. We hope this webinar will be useful for all of us and also useful for the community. Okay, bye.
Thank you very much. This is Nadia from Medical Education Center, IMERI FMUE. On behalf of all hosts and co-hosts, we'd like to thank Dr. Doni Widyandana as moderator and also a resource person, and also Prof. Gandes and Dr. Vishnu and also Prof. Siraj for the fruitful discussions, and all participants who's been really engaged in this webinar. And should you still have questions, you can email us in the email here, and we'll try to accommodate the questions and ask the resource person to answer and get back to you on that. And a survey regarding the community-based learning in your institution can be assessed both in the link that Dr. Doni has shared in the chat room, or I tried just to make the shorter version of it. And the material presented today, as well as the presented in the previous webinars, can also be assessed in this link. But please wait 6 to 8 hours to assess that, because we need to record it and so on. Or you can also assess it through YouTube channel of medicine_UI. And to get the certificate, please fill the questionnaire in this link. And we'd also like to inform you that we are having Okay, we are having the next webinar still on COVID-19 pandemic education adaptation. Next week webinar will be back on Thursday schedule on the 14th of May at 1 o'clock Jakarta time. The topic will be on student and faculty well-being. So please register yourself in the link. And once again, thank you very much for your kind attention and participations. We are looking forward to seeing you on the next webinar. Have a good afternoon and wassalamualaikum warahmatullahi wabarakatuh. For all participants are free to leave, but for speakers and resource person, please stay for a little longer for the briefing. Thank you.